Good afternoon, everybody. Assalamu alaikum. You're all very welcome to this webinar hosted by Palmet Academy about how to advance your medical career in the UK. The afternoon is going to run from 2 till 5 o'clock, and we have a number of invited speakers, and we have a break in between just so that we can stretch our legs and move about and get a cup of tea. The program is going to, as I say, have a number of speakers that we will try and cover as much of the topics that might be of interest to you and might have an impact on your career. So, just a few house rules before we start. Please mute yourself if you're not talking. It is quite disruptive to the speakers. The second thing is, if you have questions about any talk, please put your questions in the chat and we can answer them at the end of the talk. But there will be a question and answer session at the end of the afternoon where you can unmute yourself and have a discussion or ask your questions in a bit more detail. So we will hold most of the questions till then. But if you have a pressing question at the end of a talk, please put it in the chat. So thank you very much for attending today. I'll start by talking about career pathways in the UK. My name is Mahmoud Loubani. I'm a consultant cardiothoracic surgeon, honorary professor of cardiothoracic surgery in Hull University Teaching Hospital and Hull York Medical School. And I am the chair of Palmet Academy. So just a few words on Palmet Academy. It was established in 2022 in October. It's part of Palmet UK, and it is the educational arm of Palmet Europe. The main mission statement of Palmet Academy is to raise the standards of healthcare for all Palestinians through training and education. And anybody can get involved with the Palmet Academy. If they are involved in educational activities, they can be nominated to join the executive committee of the academy and become members and contribute to the activities and actually lead on activities. So my talk is just setting out the scene for medical training pathways in the UK and medical training in general in the UK. For people who are new to the country, all students after finishing medical school, they have to enter a foundation program. The foundation program is a 2 years program, F1 and F2. During F1, they are not fully registered doctors. They're still provisionally registered by the GMC. At the end of F1, they get full registration and they move on to F2. But full registration is only at the end of F1. Some medical schools around the world have 6-year programs, and the 6th year in that program can be counted in the UK as an F1, and it's accepted as completing F1, depending on the program that they have. Following completion of F2, there's been a trend in the UK recently for the foundation doctors to do a year called F3. It's not an official year, it's unofficial. They take it out of clinical practice to do something extra, to do locums, to do research, to do teaching job fellows before they decide on their own specialty that they want to enter. And there are specified routes for all of the subspecialties that you could enter. The acute care common STEM is by competitive entry. You do that for 3 years, and then you can go into emergency medicine pathway for 3 more years before you get your CCT, which is a certificate of completion of training, and you qualify to apply as a consultant. In medicine, it's the IMT program, internal medicine training. you apply for that. It is also 3 years, and then you go into the subspecialty of medicine that you want to enter. Core anesthetics, 3 years, and then you go into higher surgery, higher training. There are programs in the UK, which what they call run-through training programs, where you actually enter as ST1, and that is it. You continue in the training program till you finish. So there is no other competitive interview. In all the other three, you have to have another competitive interview before you get into the specialty. And we will talk about some of these specialties later on. Core surgical training is 2 years before you go into the subspecialty, and that is competitive entry as well. These are termed as senior house officers, but the term senior house officers has disappeared. It is not used anymore. And these are specialty registrars here in the higher surgical training. And now the new term for trainees in general is residents. They used to be called junior doctors, but that is gone. It is now residents. The other potential avenue for training is to go into GP training. GP, you finish foundation school, you get selected into a GP training, 3 years, and you're fully qualified, and you have your certificate of completion of GP training, general practice training. These are the training pathways. These are the training programs. Obviously, not everybody can get into a training program because they are limited. So there is the other route of training, which is the portfolio pathway, but that is something that you have to do yourself. You have to find jobs. You have to select jobs that will allow you to advance and progress and give you more experience as you go along to eventually allow you to apply for certificate of equivalent training, which I will talk about later on. But when you're applying for training jobs in the UK, one of the things people look at is this competition ratio. What does it mean? It means the number of applicants versus the number of posts available for training. And as you can see, this is very variable in different specialties. Some specialties are low, which means that you have a more chance of actually getting a job in this specialty. So oral and maxillofacial, for example, the competition ratio is 3.5. That's one of the lowest competition ratios. While if you look at general practice and public health, it's 167 is the competition ratio. So that means for 167 applicants, only one person will get a job. So that is an important consideration when you are deciding on a career in the UK. What are the training opportunities? That's if you want to go through a training program. And these ratios are available and published every year by NHS England. And a new thing that has come into the UK is the MSRA exam. The MSRA started 2 years ago for GP trainees, but it has come into other specialties to be used as one of the means for selection into the specialty. It has two parts, but as I said, it came initially into GP and psychiatry, and now in GP and psychiatry, it's the only qualifying exam for entry into the specialty. You don't need to do interviews, you don't need to do anything. You do your exam, and if you score highly enough above the point they want, you enter into the specialty. However, it has been used now in other specialties like radiology, obstetrics and gynae, neurosurgery, anesthetics, ophthalmology, nuclear medicine, and core surgery as well, as well as ACSS. Initially, when it came in for core surgery, they used it as the only qualifying criteria, but now they use it as one of the things that will qualify you to enter into core surgical training. But it is used in all of these specialties. So it is an important exam. It has become more established. It has two parts: professional dilemmas paper, 50 situational judgment questions, and 97 clinical knowledge questions. and anybody could apply and sit this exam, whether you're in the UK or outside of the UK. And that was part of the problem, because if you look at this here, last year there was 40,000 doctors applied for this exam. 25 thousands of them were actually overseas, and only 15 were UK trained doctors. And that caused one of the problems last year, where for the first time we ended up with medical doctors unemployment in the UK. And a lot of doctors couldn't find jobs in the UK, even though they were UK graduates, because of the competition from outside. And this has led the government this year to start thinking about doing something, especially with the ongoing strikes of the resident doctors. And the health secretary has proposed quite significant change that he's going to put through the parliament to basically prioritize UK graduates. This is going to go through as an emergency legislation, and they think it will be coming into effect by March 2026. And parts of this is, as I say, to prioritize UK graduates. Also, they want to reduce the NHS dependency on international recruitment down to less than 10%. I think currently it's about 30 to 40%. So they are going to significantly reduce the dependency. Um, they are going to introduce more training numbers, but these training numbers will be prioritized for, as I said, UK graduates. And they want to shut down locum agencies, and everything goes through bank within the hospital. Now, the prioritization also has a lot of detail. For the foundation program, you have to be a UK graduate or Irish graduate or from Iceland, Norway, Liechtenstein, and Switzerland. Why do they pick these countries? I have no idea. Um, that's for the foundation program. So you have to be a UK graduate. And then for the specialty training, which is in clause 2 of the bill that they want to introduce, UK medical graduates, which are described in clause 1, will get the priority. So for you to enter into a specialty training program, you would have had to be a UK graduate, and you would have had to do foundation training within the UK. So it's going to become more difficult for international medical graduates to enter training programs in the UK once this bill becomes law. So what are the other options available to us is the portfolio pathway. The portfolio pathway, as I said before, is you find jobs yourself, you work in these jobs, gain the experience you need to get you through to apply for a certificate of completion of training through the portfolio pathway. Each specialty has its own guidance on what is required for you to achieve in the last 6 years before your application. And this is called the specialty specific guidance. And these documents are found on the GMC website. So if you're thinking about the specialty, you should go onto the GMC website and look at the specifics of the surgical specialty that, or the specifics of the specialty you want to apply. The process of the portfolio pathway is you apply to the GMC checks your eligibility and appropriate paperwork. It's passed to the Joint Committee of Higher Surgical Training. Then that is passed to the relevant SAC, the Specialty Advisory Committee. 2 reviewers review that within a time frame. They recommend back to the GMC, and the GMC gets back to you. It's a long process. It takes up to 6 months for an application to be reviewed. This is just an example of cardiothoracic surgery. I know it's not relevant to everybody, but just to show you the number of applications. So in 13 years, for example, in cardiothoracic surgery, we had 101 applications at an average of 7.7 per year, and 66 were awarded, so 5 per year. So less than, you could say, about 1/3 of the applications are successful in being awarded a CCT. The the specialty specific guidance that I was referring to earlier, which tells you exactly what you need to be able to apply for a certificate of completion of training, is on the GMC website. And each specialty, you can just click on the link and it will take you to the website, to the actual website where it has all the details of the specialty. So I'm going to stop here. I thank you for listening to me. This is just an introduction to show you the potential career pathways in cardiothoracic surgery. I apologize, in in the UK, just to give you an idea, a general idea of the two different pathways. One is a training pathway, and the other is a non-training pathway. The training pathway is better, obviously, because you go through a structured training program. You have yearly assessments called ARCPs, annual review of competence progression, and you're nearly guaranteed at the end of it to get a certificate of completion of training and then progress to applying for a permanent position. The portfolio pathway is your own training program. You set it up, you do the jobs, the different jobs, and it will take you longer. It is more difficult, more challenging, but it can be done. And a lot of people have done it, as I showed you from the example of cardiothoracic surgery. Okay, so we'll move on to Sajjad. Sajjad Khalil is going to talk to us about potential opportunities. Sajjad, are you there?
I am. Can you hear me
Yeah,
okay?
yeah. So potential um, opportunities to get some material that you may require while you're starting your career in the UK or progressing in the UK. Over to you, Sajid.
Barakallah fiqh. Um, Assalamu alaikum wa rahmatullahi wa barakatuh. It's great to see you all and Jazakumullah khair for joining this session today. Welcome. Thank you. Um, From calling in from Manchester today, I am a portfolio GP, which means I work as a family medic. I spend my daytime working with patients in a clinical setting, but also working with patients in prison, working with patients in different capacities, including sports and motorsports. My focus at the moment, alhamdulillah, is medical education. This is something I'm truly passionate about, and it's something I've been doing under the banner of Medic Launch. So I want to spend the next 10 to 15 minutes just talking through some of the opportunities that we have at Medic Launch, and something that we can share with you all as well, as budding professionals working in the UK system. So if you all allow, what I will do is I'll showcase some of the resources that are available to you that we are offering. Thanks to PalMed for hosting us as well, and for allowing this partnership to take place. I will just share some of the opportunities that are available. So if everyone can see my screen, if you can just give me a thumbs up just to show that you can see my screen.
Yes, we can.
Jayid. So this is mediclaunch.com. Mediclaunch.com is a platform that helps medical students in the UK and abroad with a number of different areas, whether that's building medical knowledge through question banks, through flashcards, through mock examinations, even through podcasts. We have a number of incredible people that attended our podcast, which is available for free of charge on YouTube. We have a social media page on Instagram, on TikTok, where sadly you'll see me recording videos, snapshot views of medicine compressed just to help jog your medical knowledge in a way that is somewhat engaging. But the main platform that we offer is the mediclaunch.com platform. So today, inshallah, we'll be giving you free access to this platform. But what I want to show you is how to utilize the platform in its full capacity. So if I begin by just signing in, what you'll see, the first thing you'll see is the dashboard of the platform. And this dashboard is catered specifically to mainly the MLA exam, so the UK Medical Licensing Assessment. As Professor Loubani mentioned, that this is something that everyone will have to sit before starting a post as a foundation year 1 or 2 doctor in the United Kingdom. So it starts with a question bank. So we have a question bank that allows you to pick which specialties you want to be involved in. You can pick which area of medicine you want to be assessed on, ENT, elderly medicine, and you can generate your own kind of question bank. From here, you can pick new questions, incorrect questions, or all questions, and you can start to work out whether you want to do random select of questions. You can do as many questions as you want, and from there, it leads into the question bank. Now, these are the kind of questions that you tend to see in the MLA exam. And you can see that there is usually a scenario. So here, a 55-year-old man presents to the post-operative ward following a total knee replacement. He complains of severe pain despite receiving morphine, etc., etc. Which of the following is the next most appropriate step in management? And then, based on the UK NICE guidelines or the clinical guidelines, you can pick what the answer is from these. So let's just say we went with administer a muscle relaxant, which of course is not the correct answer. You would then move into understanding what the correct answer actually is. So it gives you an explanation. And the best part is you get the learning points as well. So regarding pain management, my favorite box is this box at the bottom, which is the clinical tips. And this is something that is specific to maybe medical practice. You would get a question, if we do like an infectious disease question, is something related to the clinical working of the ward. So this allows you to understand medicine from the mentality of maybe a consultant or a senior expert that has been in the system that is now sharing a clinical tip with you. The box with the learning points, this is all based on NICE guidelines. These are the guidelines that we use in the United Kingdom, the National Institute of Clinical Excellence, and basically the framework that everyone should be working from. Okay, so this is the question bank. I won't go into the question bank too much. What we also have is a review of all the questions that you've done. But the point of the question bank is to help prepare you for the medical licensing assessment. There are other question banks as well out there that you can use. So, for example, Past Medicine is a very well-established, experienced question bank. So by all means, you can test out other question banks as well, because some of them have a lot more questions than ours. So just for transparency, it is important to do your research. But Alhamdulillah, as of today, you will get free access to this. One of the other beneficial features is the flashcards. So let's say if we look at the flashcards, we have the opportunity to look at a number of different flashcards, and you can flick through and understand the different things in medicine in a nice, aesthetically pleasing manner that is just easy to remind you maybe the day before the exam or the week before. So there's the flashcards. We also have a mock examination, which allows you to do a timed question paper. With the timing there, you can pause it, you can play it, and you get the results afterwards. You can skip questions, you can flag questions and come back to them. But that is essentially the mock exam feature. One of my favorite features that a lot of the students in the UK really do benefit from is this new feature that we have developed on the left side. This is called the case capture tool. Now, the case capture tool will be especially beneficial if you are seeing patients in a clinical setting as part of your initial experience in the United Kingdom. So you put in the details of the patient. Let's say you are shadowing a GP in a GP clinic. You put down the main symptoms that the patient is having. So you see a 15-year-old boy who presents maybe with in the GP clinic, who presents maybe with knee pain. And this knee pain is worse after walking upstairs and causing problems. The patient has obesity problems. The patient also has hip pain with it. And the patient also has maybe he's a smoker. So you put in as much information here, you put in the symptoms, you put in the presenting complaint, and you fill this out. Now, utilizing AI, and this plugs into our AI algorithm, and is based on our well-fed system, you are then able to detect and generate differentials. So from this, we should be able to think about osteoarthritis, we should be able to think about musculoskeletal problems, and anything else that might be causing this patient's symptoms. And what it does is it summarizes and teaches you as though you have a teacher in your pocket with you on the ward rounds and in your clinics or wherever you may be. So it gives you a scenario overview, This will help you practice and present back to your consultants, like a 15-year-old boy presents to his GP with knee pain that worsens on walking upstairs. The pain is affecting his daily activities. He has a background of this, this, and this. So this is structured as per sort of the S-bar handover approach almost. And then it also breaks down the learning points that you should take away from the cases that you come across. So here you can see that it's important to take into account the non-traumatic causes, to recognize the association of obesity with MSK pathology, and to think about smoking as a risk factor, etc., etc. But the fun part is when it starts talking about differentials, as you can see here, and also the management plan based on the UK system. So this is a good tool, even if you're not in clinic. This is a great tool to just explore, to play around with, to really understand how the UK system works with maybe potential cases, and to understand what the initial investigations you would consider, immediate management, further management, referrals or specialist input as well. And again, it finishes off with the clinical tips. So this is something that should be utilized. You can save this. And when you save this, not only does it go back into your record of cases that you can then go back to in your career and in your development, you can reflect on, you can use for your portfolios, you can use for research. Inshallah, there's a lot of potential benefit with this case capture tool. So that is something I also highly recommend. Now, just to access the platform, the way to access it, the starting point would be to go back to the mediclaunch.com homepage. So mediclaunch.com, that is medic, MEDIC, LAUNCH.com, and I'll send the link in the chat shortly, to click start your 7-day free trial. And when you click start your 7-day free trial, it'll ask you for your first name, last name, email, password. And once you register, you will essentially get to a page that looks a bit like this. You'll get to a page that looks like this, where there's not much happening, there's not much progress on the right side. The 0% maybe as part of your progress, but then there'll be this banner at the top which says your free trial is ending soon, and subscribe. So if you click on the subscribe button, the plans are £7 a month or £42 a month. We want to proceed to payment. And when we get to this screen, if everyone can see my screen, in this box where it says add promotion code, you will type in the code PALMED100. And by clicking apply, hopefully that will make sure that this goes to £0 and you can pay and subscribe without any card details and any payment. Tamam? So that should cover that. And once you hopefully have access to this, you should essentially be onboarded. You should go back to your study portal and that red banner should hopefully disappear as well, and you should have access to this. If anyone has any issues with that, you can email our team. Our email address, again, I will share in the chat later. It's info@mediclaunch.co.uk, but we'll come on to that. Now, another very exciting element, in addition to, I've mentioned the podcasts already. The podcast is an exciting one because it focuses on different elements related to medicine, different specialists that have worked in different areas and done very interesting and inspiring things. It just makes you think beyond long term with your career, and inshallah allows you to think in a more sustainable way. But what I want to share next is our community. And the community is something we launched only recently. And the way the community works is you have an opportunity to join other medical students, other medical graduates from all over the UK. So we have students here from Leeds University, Manchester University, Oxford, Cambridge, and this is an opportunity where everyone is fairly like-minded. They all want to work together, support one another. They want to help teach. They want to help build career opportunities. They may be looking for work, maybe looking for paid opportunities, maybe looking for research, and they're all coming on here. They introduce themselves, they meet and greet, they understand what kind of career specialties are out there. So dermatology, trauma orthopedics, whichever your specialty of choice is, you can go on that specialty, and there's discussions taking place on how we can maybe further kickstart our careers, work together on research together, how we can work on other different initiatives, maybe organizing conferences, maybe organizing webinars like this, as leaders, as young leaders within the medical profession. So to join this community, it's a slightly different process. But I will talk you through it. Again, is to follow this link. So I will share this link with you all. where you'll see a link like this where you'll fill out your first name, email address, university, and a contact number, and click subscribe. Once you click subscribe on this page, it will give you an email in your inbox and it will give you a link that you follow through with. When you follow through with that link, you will essentially get access to the community page and it will ask you to start to introduce yourself on the community. And hopefully, you'll get access to what looks like this and you'll basically join the community. Okay, so the first thing I talked about was the platform, mediclaunch.com, with the discount code PALMED100. The second thing is the community link. And the third important aspect, which is the last of my discussion points for today, Prof, if that's okay, is the guide that we have made. So if I just preview this guide, this is a guide for international medical graduates like yourselves who are looking to get hands-on experience in the NHS. Now, this varies depending on what opportunities you have presented to you today, but it's still worth just reading, considering there might be something of benefit in that. Again, to access this, I'll share the link. It's a free book, it's a free ebook. You download it. You type in your first name, your surname, email address, and the ebook should be delivered to your inbox, inshallah. With that, I'll also signpost you to our mediclaunch.com growing Instagram page, which alhamdulillah is quite informative. So there are conditions, ADHD, we talked about eczema, we talked about asthma, COPD overlap syndrome, asthma, 60 to maybe 100-second videos just covering the most important things that you should take away from these conditions. So if that's something that benefits you, again, I want to give as much value out to the community as possible. So we are here to support you. My final message really is that, look, Medic Launch was set up with a vision, and the vision was to make global impact. It was to help people from all over the world to continue doing what is important to us. As a Muslim myself, alhamdulillah, the verse وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا really resonates. And that is the vision and that is the mindset that we go with. That inshallah we serve humanity, we serve the community at large as best as possible. And if you save one life, it is like you have saved the whole of humanity. So education is important, delivering, helping others is important, and hopefully you'll have the opportunity one day also to give back to your own communities, to your own friends, to your own junior mentors, and support them, hopefully in the same way that we are trying to do today. So I appreciate Palmed for inviting us on today. Really grateful for this opportunity. I look forward to staying in touch with each and every single one of you. What I'll do is I'll share my contact details as well. If anyone wants to get in touch, you can message us via the Instagram. If you want to connect with me personally, if you want to join our podcast and you want to get involved or you want to come on as a guest, our doors are open for all opportunities and all possibilities. So think big and act even bigger and work with sincere intentions. بإذن ta'ala. Jazakumullah khair.
Thank you very much, Sajid, Dr. Sajid Khalil, for very comprehensive presentation. And I do actually urge everybody to go on the website. It is for free. Dr. Khalil has given us, as Palmed members, given us all free access to this, and it has a lot of learning resources. So do avail of it. At least have a look at it. It might not serve your purposes, but at least have a look at it, and hopefully you will find something useful. Thank you very much, and we look forward to you putting all the details in the chat so that everybody can access it. Thank you very much again. And if there are any questions now, put them in the chat, as I said earlier, and we can address them now. But if there isn't, we will have Q&A at the end as well, that we can go through some of the questions where you will ask you to actually unmute yourself and speak. Okay. Thank you very much, Dr. Khalil, for now. We'll move on to our next speaker. Finally, he's managed to break through
Yeah, managed. Can you hear me?
Yes, we can. He managed to break through the Zoom firewalls. Dr. Tamer and Nakhal, you're very welcome. And please go ahead.
Can you see me sharing? Yeah?
Yes, we can.
Lovely. Assalamu alaikum. My name is Tamer Nakhal. I'm one of the vascular surgery registrars, senior vascular surgery registrars currently in Leicester. And I want to walk you through a little bit of information on how to start your career in the UK, especially in the latest news that you probably all have heard, which is not actually news because 10 years ago, when I came in to the UK in 2016, this was pretty much similar situation to what we are in today. So I thought I'll give in 7 steps how to think about it as a whole. So where are you at now? That's the question. Have you done your prep too? So then you are on the pathway. You're probably getting your GMC registration. If you're doing MRCS, MRCP, or you're in a fellowship, still pending GMC registration. With some of the fellowships, you can be boarded in your country, and then you come in sponsored fully for a position, and then you get the GMC without having the Royal College of Surgeons exams yet done. So that's where you start your journey. Then next in your journey, it should be the clinical attachment. This has been the case since the very beginning of exposures to the NHS culture. So when I came in 2016, I pre-planned it with doing an attachment, for example, in Coventry and subsequently in London. Each one was for 6 weeks at a time. These attachments are very valuable for your career. Especially it gives you more exposure into the clinical NHS system, getting to know people, and this is the very highlight of the presentation, and to know the culture and way to connect with them. Because even though you all speak probably quite good English, it's still not to that standard or the culture that you've been intermingling with. And as such, this is the first barrier, I think, in trying to break in order for you to build connections with people. And what we are talking about here is building connections with consultants, with the management body, which hopefully will open the doors for your career. Especially as you may know, as a beginning, you most likely will end up doing a trust grade job. And these trust grade jobs at the moment are becoming very scarce, given the limited funding, as well as the trend towards relying more on English breed graduates rather than IMGs. And as such, these connections are very important. I can't stress more. For those people who are considering thinking about these connections, a clinical attachment is a good start, or an observership. If you're a 6th-year medical student or you're doing your MTS or foundation internship, then perhaps think about a clinical elective organized by universities. How to get a clinical attachment? Then first thing you'd need to find the hospitals that you'd like to attach yourself to, find the department, find the consultants in charge of these departments, and then email them your query about your willingness to do an attachment with them, and whether they would accept you. Once they accept you, they then transfer you to the HR, who help you with gain further documents and be ready for your start date. So this is kind of my thinking logic second step. Third step, throughout all this, you should be building your CV really, because that's what makes you outstanding. If you think about it, we have 20,000 IMGs who are coming to the UK. All of them have finished medicine. So you are not really not in an outstanding position just having an MBBCH or MD without a CV that is reflecting that you are actually excelling most of those who will be applying, especially in the market where there is scarce jobs. Even before PLABs, this should have been a step that you've been trying to consider or even actively participating. And what we are talking about here is really getting involved in an audit. If you're doing an attachment and you're late in your CV, try to sign your CREST form from the country you came in from, where you did your internship, whether it is Palestine or Egypt or any other country that you finished your studies and internship in. Try to obtain the courses, especially the basic ones: ALS, Advanced Life Support; BLS, Basic Life Support; ATLS if you're considering surgery; CRISP, Basic Surgical Skills Course. Those are kind of basic for every foundation doctor in the UK who's considering further career. And in order for you to be competitive compared to graduates from the UK, you need to at least be up to the standard in your CV so that you are competing with them. Now, what distinguishes a person from another really nowadays is research. And this is a bit more tedious because you need more time to do a publication, probably an oral presentation or poster presentations, but it's worth considering it whilst you're doing the attachment or even beforehand if you're still doing the PLABs, as this enhances your checkpoints towards getting or securing the first job. Now, where to try to find the jobs if it's not via connections? You start via Track NHS, the e-track, where you put in your portfolio, you find the job level that you need to. Indeed is another source, and there are other sources as well. Consider the following posts if you're a fresh graduate with only an internship, يعني خلصت امتياز, junior clinical fellow F1, F2 trust grade, SHO, any trust grade job, anatomy demonstrator, or clinical research positions, because those are your kind of put in the system jobs. You could consider training, but as you may know, trust jobs is where you start at the very beginning, especially if you have IELTS or OET that is substandard to the standards they want for the training positions. Step number five is really connections, connecting with different consultants, different leaders of projects, and be involved in them. Like, for example, in research audits, be visible when you're doing the attachment, introduce yourself, go see the people, talk to them actively, and actively seek opportunities. A door hopefully will open at the end. It is on the overall, most of the people who came in through the system in 2025, they were fortunate enough to have these connections to start the first job. However, my understanding is it's getting a little bit difficult, but it's not, as they say, impossible. Well, number 6, you've done all that, you're still stuck. What's your gateway? Your alternative gateway is really to consider research degree. If you're really stuck, you can't do anything, and you're not getting, you've done all the attachment, all these 5 steps that I've mentioned, and you're still stuck, you have to think about a research degree, whether via scholarships that are readily, and a lot of them are available for Palestinians, similar to doing a master degree or an MSc or even a PhD, because you are automatically eligible to apply for a PhD once you are a doctor. It doesn't necessarily mean that you need to do an MD beforehand. And this possibly is another bite-in ticket to an NHS job. A lot of our colleagues who have done MD or PhD have got at the end a training position, or even ACF, academic clinical fellows, who essentially are currently specializing, for example, in surgery or medicine or any other specialties, and straight on to the system as a trainee. I know it can take time, but this is your gateway to the first step into the NHS. Now, the 7th thing is training posts. They are available. However, with the return of the UK graduates prioritization, similar to what I had when I came into the UK in 2016, you likely will end up being pushed into round 2, the second round. So after they fill the first round, potentially, but there is some defects. They need some more people, and all the UK graduates have applied. Then they will probably announce round 2. But you need to be ready for it to fulfill the requirements. For example, for a foundation program, you need to have the IELTS 7.5 or OET 400. If you're applying for a core training, then you need to have the CREST form signed and ready. If you're applying for SC3, then make sure that you are readily thinking ahead and have all the signatures that you need to apply for that post. It doesn't necessarily mean that you will not end up having the post, but it means that you are competing on a higher, much higher level than you would before this very decision in the UK. Those are kind of my twitches and twinges on the 7 steps of how to think about where to start your first career if you are lost. These are just kind of guidance. They are not specifically telling you what to do with each step of them. But I would be more than happy at any point, if you'd like to rediscuss, email me or get in touch with me, and we can discuss what are your specific options, because it's a not one-way tailored system. There is a lot of, as they say, loopholes or places where you can actually gain further access into how to get the first job in the UK. And I do wish you all the best. Inshallah, you will find your first job and you will secure your training that you would endeavor to have. Now it's time for any further discussions, questions. Happy to be contacted, as I said, even afterwards. Hello, can you hear me?
I can hear you. Thank you very much, Dr. Nakhal, for an interesting talk and run through the potential ways that people can get into the system. If you wouldn't mind just putting your email in the chat so that people can contact you afterwards. If there are any questions, please put them in the chat now if you want to ask them now, and we will go through them. But
Yeah,
I,
it's
I think
very important to think ahead, especially for those who are still in the PLAB process, how to be focused into getting the first clinical attachment or observership, because that's what will help them to gain access to people. There is hundreds of hospitals. Most of the people, for example, who got a job in Leicester, they did do an attachment Leicester. We understand nowadays it's all saturated in most of the hospitals, and it's very difficult to gain access sometimes, especially with the scarce funding. But that doesn't necessarily mean that it's not available and that the
Can we
attachment
stop?
is useless.
good.
I've,
Thank you.
and I've put my email as well into the chat.
Thank you, Dr. Nakhal. We appreciate your talk, and hopefully people can contact you directly to get some one-to-one advice, which is great of you. But as he said, there is not a one solution fits all, and you might get different opportunities that even weren't mentioned today, and you need to take them. Thank you. We'll move on to our last speaker before we take a break. Dr. Huda Mahmoud. Um, she works in Walsall, and she's just going to talk to us for a few minutes about medical careers. We're more surgical focused here, but we wanted a medical flavor as well. Dr. Mahmoud, Dr. Huda Mahmoud, can you hear me?
I can hear you. Sorry, I
Yes.
didn't have my mic on earlier, but thank you for
That's
having me.
fine. That's fine. Do you have anything to share? Slides to
I'm
share?
going
Or
to try. I don't have very much to share. I'll talk mostly because. So I will say to you that
if you introduce yourself first, and then go ahead, please.
sure. So I'm a nephrologist and GIM specialist. My credentials, I think, are on the screen. I graduated from the UK, so I appreciate I have a level of privilege. And then I've done all my training in the UK. I was college tutor up until recently, and the world has, as I think most of you know, has especially in the with the UK life has changed. But I've always pretty much been a physician. I love being a physician. The fact that you all want to be surgeons says a lot to me. I'm joking. I couldn't help myself. Just sorry, a little bit of humor. Um, and you know, yes, so I love physician life. I think I was born a physician. So I'm just going to talk to you about the fact that it's incredibly challenging times at the moment for IMGs. I think it's important to be honest with you. I only got a little bit of Tamer's talk at the end, but I think there are many ways that these can be circumvented. So there are many ways around. I have had clinical attachments with me as well under medicine. I think it's important to note a clinical attachment might not necessarily get you a job, but can get you certain points on application if you do it well. I will also say to you that I lived a time when I don't know if any of my other colleagues also remember this time when actually international doctors were sort of third in line to get jobs around sort of the early to sort of I'd say 2006 to 2010. So these things run in roundabouts. The truth is that this is a very reactionary bill. And I suspect in about 5 years' time, they'll find they're back again in short, have doctors in short supply and have to change things. And I say this from experience. So although I say that there's difficult times, I'm suggesting also that there is light at the end of the tunnel. So if I was to say to you, if you wanted a job in medicine, the first thing you could get a locally employed doctor. And although the BMA, the British Medical Association, is essentially saying if you've worked in the UK for 2 years, you would then be allowed, to then apply for training posts. So that is one way of doing things. Now, one of the things that I see commonly, and I think this will very much be advocated for, that yes, okay, you'll prioritize internal graduates. I think that leaves still something like 400,000 job vacancies in terms of, well, not job, but potential jobs that the NHS needs. So I'm going to talk to you about medicine. So you'll do your foundation or equivalent, and there is a CREST form equivalent. And you must make sure whatever you apply for, that, and where I see many IMGs, and I've supported many in the 5 years I've been a consultant, sort of pitfall is they don't read the small print and they don't read what is expected of equivalency. So please, if you think, okay, I want to be a medic and I want to go in via IMT, read the CREST form, see exactly what they want from you. So internal medicine training is essentially 2 to 3 years, depending on what you eventually want to be. So I'm senior in age, and so I was a core medical trainee, and we only had 2 years, and then we went and applied for us a higher specialty training. Things have changed now. So if you want to go into a group 1 specialty, and we'll go through those in a moment, you have to do IMT 1, 2, and 3. There's no way around that. If you want to go through a group 2 specialty, which doesn't include being on the general medical rota as a registrar, then only IMT 1 and 2. My advice, however, is if you are in a training position, if you are lucky and fortunate enough to get a training position, then go through and do IMT 3, because you don't know what the future holds, and you're always, and this is a Palestinian in me, saying you're always better with more qualifications than less. Hence why I got a PhD. That is a joke. Nobody needs to laugh. So group 1 and group 2. I'm going to talk about group 2 because they're the ones not on the general medical rota. And they tend to be, apart from hematology and oncology and dermatology, not really very patient-facing ones. So infectious diseases, for example, if that's your thing, you can go via group 1 or group 2. But if you're going to go via group 2, you do it with microbiology. And if you go via group 1, you do it with general internal medicine. But there's, genetics, immunology, public health. There is a link for those of you who are interested when you went for higher specialty training to look at if you're interested in a number in medicine versus a particular speciality. Clearly, some are more competitive than others. Infectious diseases is incredibly competitive. Dermatology, not surprising, incredibly competitive. Even oncology, you're looking at 7 applicants to 1 post. This is at registrar level. Group 1. So group 1 is everything else. So I'm of the generation where we didn't have to do general medicine. We didn't have to dual accredit. I definitely did it dual accredit because you're always better off, as I said, with more options than less. You don't know what the future will hold. And I'm definitely not remorseful for that. And so it's your primary specialty for me, which was nephrology, and then general internal medicine. I don't know if the surgeons have this, but general internal medicine is a sore spot in medical training at the moment because a lot of people feel that it takes away time from the primary specialty. So your higher specialty training, if let's say you pick cardiology, you do 5 years, gastroenterology, you do 4. And so I would say to you, and I'm just going to spend, and Prof. Loubani, if you don't mind just telling me when my time is up, because I can keep talking forever. Is to do out of program stuff as much as possible. And it might be your way into the NHS. So MDs, PhDs, which are often funded. Once you're in a training post, as much as possible, I would advocate very strongly for a third non-medical extracurricular, if you like, specialism of choice. And I would advocate for that, whether you want to be a surgeon, whether you want to be an orthopod, whether you want to be a microbiologist, because there will come a time that you apply for a consultant job and you will need something that makes you stand out from everyone else. And coding would be a way forward, medical education, MBA. I've already discussed about doing a PhD. Now, if you're planning on applying for training, I would say to you, please read the application process, application form as accurately as you possibly can. So when it comes to publications, I don't know if it's the same for surgery, but they have to be PubMed cited in order to get the maximal point. So there is a bit of small print with regards to getting the points, the maximal points per category. So there are a number of categories: publication, presentation, audit stroke QIP, teaching, and there's a number of others. And to give you an example, if you're going to do teaching, it has to be a 3-month teaching. So it has to be 3 months and it has to have formal feedback and you have to have organized it. And it has to meet, I've said a lot of haves and has in that sentence, but you've had to have meet all 3 of those criteria in order to score 4 points. If you taught for 3 months and you didn't have formal feedback, that isn't going to give you the 4 points. If you taught for 3 months, but you didn't actually organize the teaching program, it's not going to give you maximum points. It'll give you slightly less. So please read and pay attention to the fine print. Publication. So the maximum points you can get for publication is 8 in medicine. And that's whether you apply at IMT or you apply at HST. It's the same actually. So if you're a first author in a original research, PubMed cited, you get 8 points. And it has to be first or co-first, joint author. So that's 1, 2, PubMed cited, 3, original research. And if you are second author, I think it gives you 2 points. So 2 points less, so 6 points. And if you are not original research, it gives you a couple points less. So currently the competition, even in medicine, is so high that 1 point is enough not to get you the training post of your desire. So, and again, as somebody who supported many people through this process of their last 5 years, it's often not paying attention to the detail and not starting soon enough. So to get all the points, you really need to start 2 years in advance. To publish in most PubMed cited journals, you are really looking at 12 to 18 months just to get it published. And Prof. Loubani will tell you that by the time you've handed in the first draft and the reviewers have looked at it and they've sent you back the corrections, you're looking at 12 months from the time you submitted the journal to it being published. So organization is key, and planning is, plan, right, these are the points, this is how I'm going to get them. I have to be first also, this is my project. If anybody's interested in projects, I can also offer projects that you can potentially do remotely. But you have to start planning in advance. Otherwise, trying to get your points and scramble them together is a recipe for failure, unfortunately. Oral presentations in international conferences gives you maximum points. So think about, where can I put this bit of work in? So I've had a couple of clinical attachments with me, and to give you an example, we got, alhamdulillah, we got lucky. They did a bit of work with me around a project around my community stuff, and it got an oral presentation at an international conference. That is essentially top points. You never know when you submit to these conferences what you will get. You just have to, do your best and submit. And that if they were then to apply for a post, that's essentially, I think oral presentation is 6 points. I think that's it, Prof. Loubani. I don't have anything exciting to say about medicine application process. If you want me to talk about medicine in general, I can keep going forever. But if anybody wants to ask me questions, I'm happy to take questions.
That's excellent, Dr. Mahmoud. Thank you very much for outlining the process of entry into medicine and the requirements for training, and how you can, while you're waiting to get a training number, if that's what you want to do, you can optimize your opportunities, doing the right things at the right time, and structuring your life to achieve these targets to get into training. I'd be grateful if you are happy to share your email for if anybody wants advice on medicine on the chat, so that people can email you if they want individual advice. But if there are any questions now about getting into medical training or training in medicine in general, if there are any questions, please put them in the chat so that we can answer them now as we go along.
Yeah, so if I can add, although I think
Yeah.
before, it's sort of like I said, I've been doing this for 5 years. There are a lot of clinical fellow training programs around the country which are pocketed. So, for example, we have one with our neighbouring hospital. So this is, not necessarily for medicine, but how they pick, and these are not training, these are they're called fellowship program, and they offer a 2-year contract in that hospital. Now, how they pick people in, and again comes down to research, how they pick people is you've had to have worked 3 years in a teaching hospital. Now, I know, especially in the Middle East, it's a teaching hospital might not necessarily be something that is somebody could definitely have worked 3 years in a teaching hospital, but or PLAB or MRCP, full MRCP. So although a lot of these locally employed positions, there are ways in which, well, maybe nobody wants to ask me a question, but while they do, think about it. Let me rephrase that. There are ways in which these candidates can optimize themselves to get these jobs. And one of them is getting full PLAB, and one of them is getting MRCP or MRCS. I think if you want to be a physician, you're better off getting MRCP than PLAB. That's my personal opinion. I suspect in the future MRCP will be part of the points of the application process. And if anybody already meets those criteria, so I'm going to repeat them: 3 years in a teaching hospital, full MRCP, full PLAB, and feels they meet that criteria, they can send me their CV and I can put them through to the fellowship program. Again, I can't promise they'll get anything, but if you meet that criteria, I'm happy to forward on to the relevant leads in our hospital. But yes. That's it.
Fantastic.
Okay, I don't think anybody wants to talk to me. Yes, I'm happy. Do you want me to put my
Yes,
email
please.
in here?
If you wouldn't mind just putting your email in the chat. So if anybody wants to ask any questions or contact you about these potential opportunities or advice in general or a clinical attachment, whatever, they can uh, contact you. And thank you very much for you giving your time to explain about medical careers. Um, what we'll do now is we'll take a break and we will be back at 3:30. We have two very important topics to discuss after the break. One is about how to stay out of trouble in the UK, which is a very important thing for anybody starting in the NHS or in the UK. And also the final talk on where to go to find the jobs and how to try and maximize your opportunities of finding a job that will be suitable for you. And then we'll have hopefully questions and answers at the end. So I'll give you a break. We'll be back at 3:30. Please come back for then to be able to start at half. Okay. Welcome everybody to the second part of the Careers Day in the UK. I'd like to welcome next Mr. Hussam Adwan to give us a talk about how to stay out of trouble. Hussam?
Okay. So, my name is Hussam Adwan. I'm a consultant operative surgeon at Huda University Teaching Hospital. And this talk is kind of rather, I hope it's not too detailed, but it's enough for you to appreciate what you're getting into. And it's not to try to scare you, but it's to make you aware of the ramification and repercussion of what the NHS is about and joining the NHS as well. So it's about maximizing your potential in the NHS through safety, strategy, and support. We are all aware of the Maslow's hierarchy of needs. Still, you're starting with the base, the basic needs, the physiological, then comes next to it the safety, the love and social belonging, the esteem, personal esteem, and the self-actualization. It's applied in many settings, and in our in the NHS, it's not any different. An employee might have a different type of hierarchy as well. So it starts from the paycheck. You need the paycheck, you need that job, you need to be appointed or employed in order to support yourself and in order to support your family. So it's extremely important to be in the job and to continue working in the NHS. If you decided to continue with the NHS, you need to understand the culture, and unfortunately, to some degree, you're going to be part of it. And it's not something I advocate, but it's the reality. Unless you understand the culture around you and be part of it in a way that is allowed within your own principles, you'll struggle. There is always uniqueness about every trust and about every individual and about the people you're working with, and appreciating that's quite important. Then once you identify all of these bases, you go into the growth opportunities, identifying them and using them, and to fulfillment. And sometimes, unfortunately, that might be very challenging to reach too. This is your homework. No need to. Something is happening. Apologies. I'm not sure. Can you still see my presentation?
Yes, we can. Yes, we can.
Yes. So this is your homework, and it's I would like you to download these documents and read them, regardless of your grade, regardless what time you're doing. These are the governing elements of your progression in the UK, in any NHS job. The good medical practice from the GMC. If you're a trainee, you need to understand a reference guide to postgraduate foundation and specialty training in the UK. If you are working in the NHS, you need to understand a practical guide for responding to concerns about medical practice. Reading these will arm you a lot for the future. There are important NHS policies that you'll find in any trust, with minor variations between a trust and another. Please find them, identify them, and read them. If you are coming from Palestine, if you have a Palestinian background, if you are an advocate for Palestinian cause, or if you're doing anything that you think might be questioned, even being an advocate for climate changes nowadays puts you at risk. You need to be aware of these. These will be the policies about remediation, handling concerns, dignity at work, social media, NHS just culture, fairness at work. Unfortunately, there's work in the NHS is not always rosy and gold stars. There's a lot of referrals that takes place in the NHS, and this is from a website about NHS resolution about concerns raised between April 2019 and March 2024, 5 years, and there were almost 3,700 cases in 5 years. 48% of them were behavior or misconduct. 16%, 38% were clinically related, and 19% were health related, and sometimes they overlap between various elements. The dark reality that we as IMG graduates suffer more than our counterparts, more than our colleagues from white background, and more than our colleagues from local graduates. Ethnicity matters. 1.3% times the rate of per 1,000 practitioners from ethnic minority groups have a higher rate of cases compared to white practitioners. The place of qualification matters. 1.6 times, we suffer 1.6 times more referral from IMG's background in comparison to UK or EEA graduates. Male suffers 3 times almost the rate of referral than females. If you are more than 65 of age, you are almost 8 times higher risk of being referred to the GMC or to any other parties. If you compare the number of UK graduates working in primary care versus IMGs, and you compare the rate of referral, you will understand how this is skewed. In training grades, there are almost 61% of the referral were IMG graduates, comparison to 40% from UK qualified. And you have to double that twice, comparing the actual, originally only quarter of employee are IMGs. And this applies to other cases as well. The same stays in the hospital doctors, secondary care. More than 56% of hospitals of employee are UK graduates, 44% are IMGs, but almost half of the referrals are from IMGs. SAS doctors suffer more than that, and a consultant even more than that. The fair to refer gap, the data, IMGs are 2 to 3 times more likely to be complained about than UK graduates. The GMC's own fair to refer report admits this is often due to poor induction and systemic bias, not poor clinical skills. The insider advantage, the UK graduates often get a quiet word, an informal correction. IMGs often get a formal referral for the same error. And this has been witnessed, reported, but nothing been done about it. And I don't think anything is going to be done about it, unfortunately. The current climate of social media and political expression is quite sensitive. There is a high surveillance in the atmosphere, intense scrutiny on Palestinian doctors, particularly, and those who are trying to advocate for Palestinian cause. External groups actively reporting social media posts to the GMC. The GMC guidance is specific. Public confidence in the profession often trumps your right to free speech. The rules are again against us. If your profile links you to the medical profession in any way, if you create a profile, Facebook or LinkedIn, and you identify yourself as an NHS doctor or as a doctor, your posts are subject to regulatory investigations. And that brings us to the importance of isolating your social life from your professional life and creating scrutiny around this your social website, social media life. It's extremely important to go through this. Every one of us probably have heard about Rahma Al Adwan. She's a British Palestinian surgeon in training. She was suspended by an interim tribunal following social media posts about October 7th. Whether these posts are right or wrong, whatever the investigation is, there is an appetite for dealing with these situations, making an example of them. So you need to be aware of that. The regulator can and will remove your license pending investigation, citing a risk to public trust. This is one of the things they will keep citing. And interestingly, the GMC is rolling out teaching sessions about social media behavior, and they're using Rahma Adwan as an example. In a way, they're trying to justify what they're doing, and in another way, they're using it to scare others as well, probably successfully. In general, there are three elements of concerns. There could be conduct, it could be capability, or there could be health related. Conduct, behavior, or communication, attitude, capability, performance, negligence, training related, working beyond his or her competence level, and health, such as frequent unjustified absence. However, for us, there is a bit of a crossover. There is what I call the linguistic trap. And if you try to translate, if your mother tongue is in Arabic and the English is your second language, you're not native English speaker, and you haven't been here long enough, and you try to translate from Arabic into English, your translation is likely to come across in a rigid, unflexible, sometimes direct style of communication. And the style of communication in the UK is not what people expect. It has a bit of subtlety, a lot of introductories. It's very difficult to master. I've been here 22 years. I haven't mastered it. Probably I will never master it. Even I'm married to an English woman. Still, I need a lot to try to learn it. Our Arabic style or Eastern style of communication relies on nuances in a different way. English style is another way. That can create an issue about assessing people, assessing doctors. What might be a communication issue can be interpreted as a capability issue. This is simply because people, when they don't understand what you say, or they confuse it, or they misinterpret it, they would prefer to attack your capability, or to claim that your capability is the reason for the lack of proper communication in their view, than to say your communication is wrong, because that might hint towards discrimination, towards race or gender or language, kind of background discrimination. So they're safer to attack your capability, even if it's not in question. They're less likely to provide you or give you the benefit of the doubt. And there's always a degree of perception of people from outside that they might come across with cultural arrogance, which makes empathy towards IMG doctors less likely or potentially non-existent. So this is one of the reasons why people will find it easier to refer an IMG or not to support an IMG graduate, because they don't have that much empathy. I'm not trying to generalize, but behind the lack of support is a lack of empathy in every instance. Your defense shield relies on many aspects: yourself, your support, but there are two bodies that you need to link with. A body that protects your indemnity and another that protects your employment. The indemnity protectors, they protect your license, they are mandatory by the GMC now. You have to join an indemnity provider because NHS does not cover your GMC hearing. The indemnity does. Can be approached for advice at any stage. There is always, unfortunately, if you try to get anything related to employment, they might give you the wrong advice, and potentially they might give you an advice that can compromise your employability. So be aware of that. They're very good in supporting your license. They're very good in protecting you if it reaches an MPTS, which we're going to talk about it at some stage, or if there's any talk about capability. The unions, on the other hand, they talk about employment protection. They are optional, but I strongly recommend that you join one of them. They talk about employment rights, illegal rota changes, bullying, pay disputes, discrimination. All of this you can discuss with the union to a variable degree. There are a lot of agency and companies providing these services. You have Unite, which is historically the first one, but because it was affiliated with the Labour Party, the BMA did not want to link with them. Then came up the BMA, then the HCSA. You have the MDU, and these are union representative. Then you have the indemnity protection provided by the Medical Defense Union, Medical Practitioner Society, MDDUS, MDS, Medical Defense Society, and now there's a new society coming, and I'm not sure if there will be any equivalent in the medical realm for surgeons called the Confederation of British Surgery, where they offer you both the union representation and the indemnity representation. Unfortunately, until now, they don't have a formal solicitor support for them. So if you join them, you will not have the legal support. You have to fund yourself, which is rather expensive. But as a concept that they can advise you in both elements together is unique and is needed. Case study, the victory. All of us heard about Dr. Ghassan Abu Sitta. He faced complaints alleging his post supported terrorism. He had robust legal representation. The MPTS tribunal dismissed the case, ruling his posts were factual translations. Without professional indemnity, he would have had to fund this expensive legal defense himself. And it's really expensive. The charges per hour for legal service can range between 200 to 600, and sometimes can reach, if it reaches a lawyer level, up to £1,200 per hour, depending on the need. I don't think any of us is wealthy enough to support himself in this category. It's something you really need to be careful about. One way of sponsoring yourself is looking at your home insurance, whether it's rental or it's a purchased home, and include cover for legal cover for employment. It does add up to £100,000, but still, that's a very trivial amount of money when it comes to these cases. There's when it comes to managing concerns, there is always external tools for the trust and for the employee. For the trust, they use something called practitioner performance advice under the banner of NHS resolution. This is how they present themselves, that they're there to advise, assess, and intervene, and also they can make notifications about dangerous practitioners, and they can provide or supervise organized training. In reality, they're formally called an NCAS. They provide advice to trusts on doctors with performance issues. But while technically supportive, the PPA referral is a serious red flag. If they design a remediation, they tend to be very grueling and undoable. If you're referred, please demand that the trust and PPA adhere to their fairness and proportionality framework. Remember, they can be approached for assessment, for advice, or for remediation or reskilling. Reskilling is something, if ever offered, I'll just go for it. It doesn't have any repercussion. Remediation has a huge repercussion long term. Ensure any remediation plan is realistic, has distinct timelines and resources. If the plan is impossible to pass, it is a setup for termination. Just be aware of that. There are other agencies for external review that people can, that trusts or practitioners can approach. They can be a bit costly. A lot of trusts don't like oversight, so they don't use them, but they are more a fairer approach. The Royal College of Surgeons offers one, the Royal College of Physicians offers another. There's similar for the Royal College of Children and Pediatrics and Women as well. If things didn't resolve between you and the trust for whatever reason, there are always, they can go into one or the other direction. They can go towards medical practitioner tribunal service, or they can go towards ACAS. ACAS is a society where you can discuss or raise concerns about employment. And this usually comes through either legal team or support or through your union. The MPTS is dealt with by indemnity protection agencies like MDU. Your legal toolkit that you need to be aware of and your responsibility is you need to be aware of the Equality Act 2010. You need to be aware of your right to transparency. If anyone is trying to raise concerns, you need to have that transparency flagged clearly. Always demonstrate a degree of reflection and insight. They link together, the reflection and insight. Unfortunately, when a trust say, or somebody senior say you're lacking insight, it means you don't agree with them. But if you demonstrate a proper reflection of all aspects and a proper learning, you really protect yourself very well. Be aware of your right under the GDPR. And you can always request submit subject access request if you have any question about transparency, or if you need more information. It's your right to ask for all information about you, including any communication through WhatsApp. In reality, NHS really difficult bodies to get any access to any of this information, but ultimately they will give you something that you can understand what's going on if you are in trouble, and hopefully you will never be there. This is a case study for Dr. Omar Karim. He proved that the GMC treated him more harshly than a white doctor for similar issues. He won a discrimination claim in court. And this brings us to who has the onus of proving a discrimination. And this is a problematic. If you're raising concerns about discrimination against race, against religion, unfortunately, the onus is on you to prove that the trust has acted discriminatorily. If you are raising concerns about disability, the onus is on the trust to defend themselves against that. And that shift of onus makes things a bit different. So be aware of your right, discuss them with your union. The MDU doesn't know about these rights, don't discuss them much, to be honest, or MPS. And identify how to deal with any difficult situation properly well in advance. Now, how to deal with the problem? You're not going to sail through the NHS without any issues. There will be some issues, but they vary in degree, and to what degree they can escalate is different. Always maintain good records. This is your shield. Do not underestimate the importance of recording in the patient. If you see a patient, if you have an interaction with a patient, please record it. If you don't have access to recording it in the hospital record for whatever reason, record it in your own diary, in your own reflection, in your own portfolio. If there's an incident that creates concern for you, jump to your portfolio, perform some reflection, write about it, write about the incident please be careful not to mention any identifying features or name or any characteristic of your patients or the people you're dealing with, but write something about it. If you have an interaction with any colleague, feedback from colleague, write it down, do some reflection, upload it to your e-portfolio. These steps demonstrate that you are reflective, you have an insight, and you're willing to learn. And nobody can take that from you. And they will help you immensely if things escalate further. Be open about mistakes. If you make a mistake, or if you feel something went wrong for whatever reason, be open about it. Don't try to defend it or justify it. Identify what it is, identify your learning from it, and again, put it down as a reflection in your e-portfolio, whichever system you're using. If people try to use these episodes or mistakes or errors to bully you or to put you under harshness or to put you under pressure, be the wise in the room. Change the language, change the narrative to learning and development. Every mistake is an opportunity for learning and an opportunity for development. And this is the reality. As doctors, every doctor will make mistake in his life. If we keep beating ourselves about it, we'll never progress and we'll never treat our patients. Seek help early. Identify a mentor, identify a coach, which is going to come next point. A colleague that you trust, but this is only for learning purposes. Challenge bullying if it happens. Find a mentor and a coach. Do not vent to colleagues. If you want to discuss a case with a colleague, feel free to discuss the case with a colleague if you trust him. But don't just vent and don't just share information with your colleagues unnecessarily. Your colleagues are not your friends. Your colleagues are not your mentors or coach. If you are in a mentor or coaching relationship, these are bound by contract, and normally you sign it or it's unsigned contract. Most of the mentorship relationship that you can seek, and you can seek some from the BMA or from HCSA or from the unions, from other unions, they will ask you to sign a contract with them, which protects your confidentiality and theirs as well. So don't use your colleagues to vent your emotions to them. Anything you say can come against you one day, so be aware of that. Summary and checklist. Get insured, union, BMA, HCSA, and get indemnified. Know the rules. Read the GMC good practice, medical practice. Know your weapons. Understand the PPA fairness framework. Understand what subject access request means. Understand Equality Act and when to trigger them. Seek help early. Burnout looks like incompetence to the GMC. See your GP if you are struggling. I think that that is my presentation, Professor. I need to stop.
Thank you very much.
If there is
Hussam.
any question, I'm more than happy to receive it.
Yeah, thank you
How
very
can I
much.
stop the sharing?
Yeah, stop sharing.
I'm trying.
Okay.
The sharing has stopped already?
No, it hasn't. So if there are any questions, please put them in the chat. We can discuss them now about this presentation. But if there isn't, and you have questions at the end,
It is a very big subject. It's not a small one to summarize in 10, 15 minutes or 20 minutes. And there is an in and out of it. I'm not trying to scare people from this, but you really need to be aware of what's going around. You need to protect yourself with the social media. Please go through your social media. A like can be dramatic. Assess if you are liking something or if you're trying to distribute something, what repercussion could come back to you. If this is there is what's happening in Gaza, we're all emotionally involved with it. We all want to help, but if you're not in a job and you are trying to defend yourself, you can't help. So it's that kind of balance. Some information is worth sharing and really worth sharing. Make sure this information are for educational purpose. Don't try to make similarities. Don't try to compare something happening there with something else. You don't need to. What's happening in Gaza speaks for itself. You just need to demonstrate and present the facts. You don't need to try to link the facts. Let the people judge for themselves and extract from for themselves what they want to extract. You're not trying to teach them what this means. You're trying to show them what is happening. And there's a complete difference between the two. And if the post is shared enough, you don't really need to keep sharing it because there are events happening every day, and the new events supersedes what happens in the past, and is more insightful than the past. So we don't need to bring things from the very beginning of what happens as things are evolving and going ahead. And there are a lot of ways to be positive about even the negative. So despite what's happening in the war, despite how much we are emotionally involved in this, you need to be mindful that we are learning from it, and we are demonstrating resilience and demonstrating how civil and how human we are. And this in itself is a treasure, and we need to keep that focus on. There is a lot that we are learning, and there is a lot we are going to teach the world with. So be aware of that.
Mr. Adwan, thank you very much, Sam, for very insightful talk. We'll move on to our last talk for today from Mr. Tamer Abdulghafour, and he's going to talk to us about trying to locate jobs in the UK and where to go, where to find them, and hopefully reflect on his personal experience as he is new to the UK. Dr. Tamer.
Thank you very much, Dr. Loubani. You can see my presentation.
Yes, we can. If you want to put it in presentation mode.
Yes. Okay. Thank you very much for this opportunity. My name is Tamer Abdulghafour. I am Senior Clinical Fellow, Cardiothoracic Surgery, Herefield Hospital, London. I'm here since almost 1 year now. I joined non-training pathway, portfolio pathway, most probably. I will continue on that. So in this presentation, we will talk based on what my colleagues have been started regarding that training, non-training, and the post. In this, I will focus more on how to find the jobs you want to start work, especially for non-training, because Dr. Loubani spoke about the training pathway. I will speak about the jobs for non-training pathway. So as we all know, there is two main sector in UK, the non-NHS and private sector. NHS sector around 90% of the jobs, private sector mostly for the consultant and highly specialized physician. So the focus will be on NHS. NHS also divided in training and non-training. Training, we already spoke about that. Non-training include the grade, a trust grade, and the clinical fellow, and locum. And as we spoke earlier, the priority have been changed, although it seems to be since years, but now it will become more like a law. So we have to work more on increasing your UK NHS experience so you can apply for the training post. Before we start looking for any job, we have to have some essential things. The GMC registration should be, especially, we had a lot of a junior doctor who came to UK through the scholarship, which means master degree in one of the universities. So before you start thinking, I want to go to the job in NHS, you have to have GMC registration, and most probably through BLAB pathway, because no previous experience. If you had more experience, even you can go through MRCB or MRCS, so you can get the full GMC registration. If you are, and this will become more difficult as we spoke before, CRIST form is very important. If you had more experience outside UK and you want to clear for the foundation year 1, year 2, you should have CRIST form, which a group of skills you have to be filled and signed off by a supervised consultant. So we will start with the action part of the lecture. So where you can find, you had GMC registration and you are in UK in searching for a job. So we have two websites, the NHS jobs website and the Trace jobs also website. In this, you will find a group of vacancy in the whole England and Wales, and you can apply. And here it's very important to stress a few points. First of all, the secret behind this is to read for each application the person specification. This is very important to read for each job. And not only this, is this website allow you to automate your search. For example, you are searching for a trusted grade or senior fellow or junior fellow, or the specialty even, or the place. So you have to automate your search when you're looking for. And maybe you can add option of email alert. This will lead to you to be notified as soon as possible any new vacancy happen. Indeed, the website have also phone application, so you can have in your phone and so you can search on that. So mastering your application is very important. You find a job on job and website. Some of our applicant will just copy paste. It's not this the way, because you know a lot of applicant will be in the same. So you have to make your profile more attractive. It's not mean you should lie in your profile, but you should present your profile in attractive way. Especially there is special terms you have to use when you put this profile. Part of this is to use the person specification for each job. Use the headings and subheadings that they are using in your personal statement to show I am already read this personal specification, and I have the qualification that accommodate these headings and subheadings. And when they ask you about evidence, you have not mentioned I am good in this. You have to provide evidence. And I felt STAR technique by giving situation that fulfill these skills will be helpful. And make sure when you use this technique to use around 50 to 60% of your paragraph, talking about what you did. That will differentiate when busy consultant have a look on the profile. And believe me, most of the consultant will have a look on the day of interview on your profile. If you selected for, he will look to the bullet. So make your statement like a bullet to what you think it's attractive to this trust or this institute or this hospital. So you should be specific, you should be to the point. One more website is BMG website. It's very nice website for two things. First of all, it for more senior jobs like consultant job or senior fellow, but sometimes they present some junior fellow post. More importantly, in this website, they have some articles about how to do the interview, how to do the to improve your personal statement. So these articles is very nice to read to improve your skills when you apply for jobs. And one more things, it's although hectic process, but you in your early career you should apply for many jobs so you can get more interviews so you can get a jobs. These things, it will be changes as long as you increase in your experience. When you increase in your experience in special field, you will find less applicant for this. I will tell you my experience. When I applied, I was previously finishing my Arab board in cardiothoracic surgery. I have experience of 7 years in addition to what we can call the other additives, the audit research and skills and observerships. So of 8 application I applied, I got 4 interviews. Of these 4 interviews, 2 have been accepted, and at the end I was on dilemma which I should choose. But finally, as long as you increase your experience, you will find it's easier to get a job. That's why, as Tamer mentioned, it's very important to gain any experience, even attachment, because this will not open for you in the doors, but will give you for the hidden network, how's the things going on. This is the other pathway, but we will not talk because already talk about this. There is other way like recruitment agency, and this is especially for people from outside, medics, healthcare, ID, medical, Athona recruitment, and whole doctor. But this agency shouldn't be alternative for your own search, okay? And one more things with this agency, you should be clear with them about your grade, because they will request some paper from you, your preferred specialty, your preferred work condition. More often, this is a very nice platform. I found it. Misli platform. This, for example, you have GMC registration and you are on the university for whatever your program, master or PhD, and you want to gain experience. You can apply through Misli platform for some local shift. This maybe you had little experience before, or let's say you can do especially at the beginning, some coverage over the weekend. You can apply through this platform and you will find what the possible shift available. This will give you more exposure to the NHS work, but you should be important. If you didn't work before in NHS, you should be careful when you apply for the first time. You should read the practical guideline as much as you can for the place you will apply. Another, when you do attachment, and this I saw in my trust, when you do attachment, sometime they will have some SHO locum, and if you had the full criteria like GMC registration, they can give some locum for the people who is in attachment. More important, this have been talking again and again, and I believe this is more stressful, is the digital presence. That means link it in. This will give you insight, because, for example, on my LinkedIn, I have following the whole trust that have cardiothoracic service, and I can see on weekly basis they are putting their post on their pages, especially the consultant, because they are searching also for good physician to hire for their post. So they try to popularize their post when they have. So it's very important. And not only to see advertisement, is to have direct contact with consultant. For example, you want to work in special trust or hospital, and you know this consultant there, you can have a chat with him on direct in a professional way by your experience. So you can have a chat with him regarding the discussion. If you had any post, if you had any attachment opportunity, if you had any research opportunity, I can come, I can help. The other things we were talking is the attachment in the hospital will give you exposure to the hidden job market, because sometimes the job will go internally without even advertisement sometime, but most of the time you will find it in NHS jobs. Finally, this is the final slide for my presentation. We know all about the new rules regarding what we call the priority for training post. So your way is not to lose the hope, but your way is to have good experience in the NHS. So when you will apply for the training post, you will have good profile. And I will be honest, for anyone who graduated outside the UK and he doesn't have any good experience after his graduation, it will be difficult to be competitor for someone who just graduated from here. He know the secret of the system, who know how is the flow of the system. It will be very difficult. So don't be sad. You have experience after you graduate outside the UK, and then you work a service job for 1 or 2 years before you enter the training. I believe this will protect you when you start your training, rather than it's obstacle you to delay your starting a training. Thank you. I'm opening for any question.
Thank you very, very much, Tamer, for sharing your experience and wise advice on how to start looking for a job in the UK. Is it Yusuf Al Hindi?
Hello. Yes, it's Yusuf.
Hi.
Yeah.
Yeah. Carry on. Go on. Ask a question, please. Just
Yes.
introduce yourself first, if you don't mind.
Oh, sure. Yeah. Hi. I'm Yusuf Al Hindi. I currently work as an anatomy demonstrator at the University of Birmingham, and I'm looking for NHS jobs. Basically, my first one. I cleared my GMC in September 2025. So yeah, I want to ask, what advices do you have for someone who's trying to seek like his first NHS job, who doesn't have clinical experience other than internship? I can't sign CREST form, and also I can't go back to my home country to gain clinical experience and hopefully to sign the CREST form. For example, I'm from Gaza. Due to the war, I can't go back. So I just like have the chances to apply through the NHS or track jobs, which always I get rejection. So yeah, so I don't know if you have a specific advices in this situation. I tried clinical attachments as well.
But the CRIS form will have to be signed by somebody you have worked with. So it's a clinical attachment is not going to be sufficient for a CRIS form. So unfortunately, you're going to have to find an attachment, stick with it, and try and get into an F2 position. There are very occasional standalone F2 positions that come about sometimes because of doctor's sickness last minute, and a vacancy becomes available on the rotation and they need somebody, so you could step into it. And I'm saying this because I'm saying it as an example because it happened with somebody who was doing a clinical attachment with me. He did the clinical attachment with us for 6 weeks. Then he did a clinical attachment in oncology. But while he was doing the oncology, a vacancy became available as an F2 on the rotation, and he applied and he managed to get into that F2 position, and now he has a full year of F2, and he will finish it and he will get his crest form. It will depend on you being in a place where you can hopefully get that opportunity. Anything else you want to add, guys? Yeah.
Sorry. So if you have done your internship, the problem if you haven't done your internship, but if you have done your internship, you don't need to stick to the FY1, FY2 agenda. You can apply for example, you can apply for teaching fellowship. You can apply for education fellowship. You can apply for research fellowships, which has a clinical component with it. And that might be easier sometimes to apply to than to look for a clinical job per se. As long as it has a clinical component that is supervised and maintained, then the clinician can sign you off the crest, even if it's not a foundation year training year.
So if I apply for educational or teaching fellowship,
as long as it has a clinical component, it's not just pure teaching.
Okay.
It's
So,
pure.
So what he's saying is that some of the teaching jobs you can spend a day or two in clinical practice, so you'll get exposure to the clinical practice. Like in our teaching fellows for our Hull York Medical School, they have an arrangement where whichever specialty they're interested in, they can join the specialty for a day or 2 days a week, which will give them the exposure that they need. So that's an option for you, as Mr. Adwan was.
Provided you have completed your internship year.
Yeah.
And even if you don't have that option, even if you don't have a clinical component of teaching, if I have the option between a teaching job that is within the NHS or a clinical attachment job, I will go for a teaching job because it will give you more formality, a little bit of pay, and more links to people that can lead you to a job. It has a higher potential to put you in a job later on than a standard attachment. So please don't dismiss these jobs. Teaching fellows, research fellows, some research grants application. These are opportunities you can just use for the time being until you find a clinical job at the end of it.
So the teaching fellow jobs, this is the new system in the UK. It wasn't present 4 or 5 years ago, but now all medical schools in the UK employ teaching fellows who are usually, after finishing foundation school, people, instead of doing an F3 year doing nothing, they apply to do these teaching fellows while they're trying to sort out their higher specialty training applications. So there is a lot of these. I mean, in our medical school, there's about 60 jobs just in our medical school. So all medical schools have teaching fellows. So have a look at them, see what specifications they involve. Are they pure teaching? Or even if it's a pure teaching, it will allow you to build contacts. It will allow you to build your own CV. You might get presentations, publications.
It makes you more competitive. And
it will make you stronger. So even if it doesn't have that clinical.
And one last thing, if you have a GMC registration and as a fully registered with license to practice, then you can also apply for an IMC, Irish Medical Council registration, and you can open markets for yourself in Ireland as well, provided you have your internship.
Okay.
If you don't have an internship, that's a big struggle.
Thank you. Yes,
Professor.
Yes, go ahead.
If there are several reasons why people have good qualifications, good experience, and don't get shortlisted. Aside from the obvious, which is you are Palestinian, coming from Gaza, and people don't want a hot potato. Aside from that obvious, the part of it could be the information you put and the way you put your information in the application form. One way you can test it is by using AI. I suggest, for example, Gemini from Google, Gemini 3. Put the application description or the job description of the job you're applying for, and put your CV and ask the AI to compare the two to see if you fit for that particular job and how to maximize your ability to apply for that job. The application system is very rigid, and you really need to be clever about what you put and how you phrase your credentials, not to overstep it, not to undermine it. in a very measured way. And you need to target the jobs that you think you are going to be successful in than others. And this comes with experience and mentorship. I'll reiterate, there are the teaching for people who are coming from Palestine, it's easier to target teaching fellowship, easier to target research fellowships, easier to target some form of a combination of the two. We have in Wirral, for example, a clinical fellow jobs for people who are SHO grade going to the registrar grade, or even younger, who do a degree, a master's degree, along with their attachment, along with working on calls. You'll find something similar in many places. I think most of the jobs will come across between starting to come now for April employment, or for February if they haven't started now. So keep an eye on that. But double check what you use, what you're entering in the application form using AI. It can help.
Thank you very much, everybody, for attending on this Saturday afternoon, and we wish you all the best of luck. You have received some emails, addresses here that you might be able to communicate with Dr. Tamer Nakhal and Dr. Huda Mahmoud. You have received some information about launch medics and the resources that you can utilize for now and in the future. And we hope you find them very useful. We will have a series of these webinars going forward. Your feedback will tell us where to the areas that you would like us to concentrate on. So I do appreciate you filling up the feedback form when you receive it. Thank you very much, everybody, and have a good weekend. Thank
Good
you.
weekend, everyone. Assalamu alaikum.
Bye-bye.